Engineered muscle patch fixed failing hearts in an early study. Overview. Recent advancements in stem cell research have introduced engineered muscle patches as a potential solution for patients suffering from heart failure, particularly those awaiting transplants. A clinical trial involving a 46-year-old woman who had experienced a heart attack in 2016 demonstrated the promising capabilities of these patches in stabilizing a failing heart. This innovative approach could revolutionize treatment options for the estimated 60 million individuals globally living with heart failure. The clinical trial. The notable study featured a 46-year-old woman who suffered a heart attack in 2016 leading to progressive heart failure. After exhausting all conventional treatment options, she participated in a clinical trial in 2021 where she received 10 engineered patches, each containing 400 million cells derived from induced pluripotent stem cells iPSCs. The patches were implanted on the surface of her heart through a minimally invasive procedure. Key findings. 1. Stabilization of heart condition. Following the implantation of the patches, the patient's condition remained stable for 3 months. This stabilization was crucial as it allowed her to proceed with a heart transplant, which is often the last resort for severe heart failure cases. 2. Integration and vascularization. Researchers observed that the patches adhered well to the heart tissue and developed new blood vessels, indicating successful integration and biological activity. This is a significant improvement over previous methods that often resulted in complications like arrhythmia or tumor growth. 3. Safety and efficacy. The trial reported no adverse side effects during the 3-month follow-up period. This suggests that the engineered patches could provide a safer alternative to traditional heart failure treatments, which often rely on risky procedures or medications. Broader implications. Heart failure is a leading cause of death worldwide, with many patients unable to receive heart transplants due to a severe shortage of donor organs. Current treatments are limited and most patients only have access to palliative care. The introduction of muscle patches made from stem cells offers hope for a new treatment avenue, especially given that less than 1% of heart failure patients qualify for transplants. According to study co-author Wolfram Hubertus Zimmermann, a pharmacologist at University Medical Center Göttingen, this approach is particularly important as it provides another option for patients who are currently facing limited choices. The patches can be seen as an interim solution, potentially improving the quality of life for patients awaiting transplants. Technical aspects. The patches are crafted from iPSCs, which are cells reprogrammed from adult cells to have the ability to differentiate into any cell type, including cardiac muscle. The patches were created by mixing these cells with collagen gel to form a viable graft that could be stitched onto the surface of the heart. This technique avoids the risks associated with directly injecting cells into the heart, which has been fraught with complications in previous experiments. The minimally invasive procedure involved making a small incision in the chest, allowing the researchers to carefully attach the floppy patches to the beating heart. This required precision and skill, as maintaining the shape and position of the patches during the procedure was critical. Future directions. While the initial results from this clinical trial are encouraging, researchers stress the need for further studies to assess the long-term safety and efficacy of the muscle patches. The ongoing trial includes 15 participants, and researchers hope to expand this number to gain more insights into the treatment's effectiveness across a broader population. The scientific community is particularly keen on understanding how well these patches perform over an extended period, as heart failure treatments must ensure sustained benefits without introducing new complications. Conclusion. The development and initial success of engineered muscle patches represent a significant breakthrough in the treatment of heart failure. By utilizing stem cell technology, researchers have created a viable option that could improve the lives of millions suffering from this debilitating condition. As more data from ongoing trials emerges, there is hope that these patches could usher in a new era of cardiac care, providing solutions for patients who currently have few options. The clinical success of this approach could not only enhance the quality of life for patients but also potentially save lives by bridging the gap for those awaiting heart transplants. In summary, the promising outcomes of this early study set the stage for future research that could lead to widely available treatments for heart failure patients worldwide. Further trials and long-term follow-up will be critical to ensuring the safety and effectiveness of these innovative muscle patches. The recent study on engineered muscle patches derived from stem cells presents several counterintuitive insights regarding heart failure treatment and stem cell application. Here are the key counterintuitive pieces of information identified in the content. 1. Temporary solution versus permanent fix. While heart transplants are typically viewed as the definitive solution for severe heart failure, the engineered patches serve as a temporary solution rather than a permanent fix. This runs counter to the common perception that only a full organ transplant can effectively resolve the underlying issues of a failing heart. The patches provide an innovative way to stabilize a patient's condition enough to wait for a transplant, highlighting a shift in therapeutic strategy from permanent solutions to interim support mechanisms. 2. Stem cells from other donors. It is often assumed that using a patient's own stem cells would be the safest and most effective method for regenerative therapies, minimizing rejection and complications. However, the patches used in this study are derived from a donor's stem cells, not the patient's own. This challenges the traditional view that autologous self-derived cells are always preferable, demonstrating that allogeneic donor-derived cells can also be successful when carefully managed, particularly in a patch form that minimizes direct interaction with the immune system. 3. Integration without complications. There is a prevalent concern regarding the complications that can arise from stem cell therapies, such as tumor formation and arrhythmias. In this case, the patches not only integrated well with the host heart but did so without inducing these feared complications. This is counterintuitive because many previous studies of stem cell injections into the heart have resulted in such adverse effects, leading to skepticism about the safety of stem cell therapies for cardiac applications. 4. Grafting on the surface. The idea that effective heart repair can be achieved by simply placing patches on the heart's surface may seem simplistic compared to complex surgical interventions or direct injections into the heart muscle. This highlights a paradigm shift in the approach to cardiac repair, suggesting that less invasive techniques may be just as effective or even superior in certain contexts, contradicting the belief that deeper, more invasive procedures are necessary for substantial cardiac repair. 5. Usefulness for non-emergency situations. The patches are not intended for emergency scenarios but rather as a bridge for patients who are already experiencing heart failure. This counters the general expectation that more immediate interventions are always preferred in acute medical crises. Instead, it suggests a nuanced understanding of heart failure management where stabilization prior to a more definitive treatment like a transplant can be beneficial. 6. Efficacy in limited trials. The early success of the patches in a single patient and a small monkey study could lead to skepticism about their efficacy as a treatment option. However, the researchers are optimistic about the patch's potential to stabilize heart function significantly, which challenges the notion that extensive trials are the only path to validate new treatments. This potentially opens the door for more innovative therapies to be explored, even with limited initial data suggesting a need for a more adaptive approach to clinical research. 7. Palliative care as a primary context. Given that less than 1% of patients receive heart transplants, the notion that palliative care is the endpoint for most heart failure patients is counterintuitive. The engineered muscle patches provide an alternative avenue of treatment that can significantly improve the quality of life for patients who would otherwise have no options aside from palliative measures, suggesting that innovative approaches can revitalize the treatment landscape for chronic conditions. 8. Potential for growth and maturation. The patches are described as being able to adapt, grow, mature, and start to support the failing heart, which contradicts the expectation that artificial or lab-grown tissues would lack the dynamic properties of natural tissues. This suggests that engineered tissues can potentially mimic biological functions more closely than previously understood, challenging assumptions about the limitations of synthetic biological materials. These counterintuitive revelations may reshape our understanding of heart failure treatment and stem cell applications, providing a fresh perspective on how engineered tissues can play a pivotal role in cardiac health management. The report on engineered muscle patches for treating heart failure presents several critical and often overlooked aspects that underscore the innovation's significance. Below are key points of the report that deserve attention, along with explanations of their importance. 1. Induced pluripotent stem cells (iPSCs) and their role. The patches used in the study are derived from induced pluripotent stem cells (iPSCs), which are adult cells reprogrammed to an embryonic-like state. This is significant because iPSCs can differentiate into any cell type, including heart muscle cells. The ability to use iPSCs means that the patches can potentially be tailored to the patient's own cells, reducing the risk of rejection and complications associated with donor tissue. This technology represents a shift in regenerative medicine, allowing for personalized treatments that could enhance compatibility and efficacy. 2. Minimally invasive procedure. The method of implanting the patches is noted to be minimally invasive, involving a small incision to stitch the patches onto the heart's surface. This aspect is crucial as it implies a reduced recovery time and lower risk of complications compared to traditional heart surgeries. Many patients with advanced heart failure are often too weak or ill to endure major surgeries, making this approach a viable option for more patients who are currently limited to palliative care. 3. Short-term stability leading to transplantation. The report highlights a critical outcome: the patient's heart condition stabilized for 3 months post-implantation, allowing her to qualify for a heart transplant. This finding is significant because it illustrates the potential of engineered patches as a bridge therapy, supporting patients until a suitable donor heart becomes available. Given that less than 1% of patients in need receive transplants, this interim solution could save lives and improve the quality of life for many waiting for a transplant. 4. Integration with existing cardiac tissue. The observed integration of the muscle patches with the heart tissue, forming blood vessels and adhering well, shows that the patches are not just temporary fixes but can contribute to the heart's functionality. This insight is often overlooked in discussions about artificial or engineered tissues, which can sometimes face issues of integration and functionality. The successful integration suggests a promising future for using such patches in more extensive cardiac repair applications. 5. Long-term studies and future implications. While the report emphasizes the importance of ongoing trials and the need for larger participant groups, it also hints at the broader implications of this technology. The long-term health outcomes of patients with these patches will be critical for determining their viability as a standard treatment. If proven effective, it could lead to a new paradigm in heart failure management, potentially shifting the focus from merely managing symptoms to actively repairing cardiac function. 6. Comparison with previous approaches. The study's mention of previous attempts to inject stem cells or muscle cells directly into the heart, which resulted in complications like arrhythmias and tumors, highlights the engineered patch's relative safety. This distinction is vital because it reassures both patients and physicians about the reduced risks associated with this new method compared to earlier techniques that might have been promising but ultimately fell short due to safety concerns. 7. Addressing a global health crisis. With an estimated 60 million people worldwide living with heart failure, the potential impact of this technology cannot be overstated. The report notes that heart failure is a leading cause of death and many patients lack effective treatment options. The introduction of engineered muscle patches could provide a significant breakthrough in addressing this global health challenge, offering hope to millions who currently face limited choices. 8. Ethical considerations and accessibility. As with any groundbreaking medical innovation, ethical considerations surrounding the use of stem cells must be addressed. The report implies that the use of iPSCs may mitigate some ethical concerns associated with embryonic stem cells, but public perception and regulatory frameworks will play a crucial role in the broader acceptance of this technology. Moreover, ensuring that such therapies are accessible to diverse populations will be a significant challenge that must be met to realize the full benefits of this innovation. 9. Potential for combination therapies. The concept of combining engineered patches with existing therapies like medications or lifestyle changes to enhance overall treatment outcomes could open new avenues for heart failure management. This integrative approach could lead to more comprehensive care strategies that not only focus on the mechanical aspects of heart function but also address the underlying causes of heart failure. In conclusion, the report on engineered muscle patches represents a significant advancement in the treatment of heart failure. By recognizing the importance of iPSCs' minimally invasive procedures, the potential for long-term integration, and the broader implications for public health, we can appreciate the transformative potential of this innovative approach. As research continues, the ongoing trials will be crucial in validating the efficacy and safety of these patches, potentially leading to a paradigm shift in how heart failure is treated globally. 1. Clinical trial evidence and patient outcomes. The study showcases a significant clinical trial involving a 46-year-old woman who received engineered muscle patches made from induced pluripotent stem cells iPSCs after suffering a heart attack in 2016, which led to heart failure. The implantation of 10 patches, each containing 400 million cells, resulted in her heart condition stabilizing for 3 months, during which she was able to receive a heart transplant. This outcome demonstrates the potential of engineered muscle patches to serve as a viable treatment option for patients awaiting transplants, especially given the limited availability of donor organs. The stabilization of her condition without complications highlights the patch's ability to integrate into the heart and form necessary blood vessels, suggesting a promising avenue for future cardiac therapies. 2. Innovative use of induced pluripotent stem cells. The research emphasizes the groundbreaking use of iPSCs to create heart muscle patches. These stem cells, which are reprogrammed from adult cells, allow for the generation of heart tissue without the ethical concerns associated with embryonic stem cells. The patches not only provide a means to repair the heart but do so in a manner that minimizes risks such as arrhythmias or tumor growth, which have historically plagued similar procedures. This innovation represents a significant advancement in regenerative medicine and cardiac care, offering a new strategy to treat heart failure, a condition that affects approximately 60 million people globally. 3. Potential impact on heart failure treatment. The findings from this study could have transformative implications for the management of heart failure. With less than 1% of patients currently receiving heart transplants, the introduction of engineered muscle patches may offer a critical interim solution for those with advanced heart failure who are typically reliant on palliative care. This treatment approach not only addresses the immediate needs of these patients but may also reduce the burden on the healthcare system by providing a less invasive alternative to heart transplants and artificial pumping devices, which are costly and come with significant complications. 4. Need for further research and long-term studies. While the initial results of the clinical trial are encouraging, researchers caution that the long-term efficacy and safety of the muscle patches remain uncertain. Ongoing trials with a larger cohort of patients are necessary to determine the viability of this treatment over time. The study's authors have expressed the need for further investigation into the patch's performance and integration within the heart, as well as the development of protocols for long-term patient management. Understanding the long-term outcomes will be crucial in establishing the muscle patches as a standard treatment option for heart failure patients, potentially ushering in a new era of cardiac care. 1. The case of the first successful heart transplant, 1967. In December 1967, Dr. Christiaan Barnard performed the first successful human heart transplant at Groote Schuur Hospital in Cape Town, South Africa. The patient, Louis Washkinski, received the heart of a 25-year-old woman who had died in a car accident. This groundbreaking procedure marked a pivotal moment in cardiac surgery and organ transplantation, demonstrating the potential for saving lives in severe heart failure cases. Although Washkinsky died 18 days later due to pneumonia, the operation opened the door to further advancements in transplant medicine. 2. The use of stem cells to repair heart tissue post-myocardial infarction 2000s. In the early 2000s, researchers began investigating the use of stem cells for cardiac repair following heart attacks. Initial studies involved injecting stem cells directly into the heart muscle of patients who had experienced myocardial infarctions. These trials aimed to regenerate damaged heart tissue and improve heart function. While some early results were promising, many studies revealed inconsistent outcomes, leading to the exploration of more sophisticated techniques such as engineered muscle patches similar to the recent trials discussed. 3. The case of the total artificial heart 1982. The total artificial heart, developed by Dr. Robert Jarvik, was first implanted in a human patient, Barney Clark, in December 1982. This innovative device was designed to completely replace the function of a failing heart. Clark lived for 112 days post-implantation, leading to widespread media attention and ethical discussions about end-of-life care and the implications of artificial organs. Although the total artificial heart was a temporary solution, it paved the way for future advancements in mechanical hearts and heart assist devices, highlighting the need for innovative solutions in the face of organ shortages. The future outlook for engineered muscle patches as a treatment for heart failure is promising, with the potential to reshape the landscape of cardiac care over the next decade and beyond. Here are some key predictions and considerations regarding this innovative technology. 1. Expanded clinical trials. As the initial results from the early study indicate, the patches have shown positive outcomes in a small cohort of patients. Future trials will likely expand to involve hundreds or even thousands of participants globally. This will provide a more comprehensive understanding of the patch's safety and efficacy across diverse demographics, including varying ages, comorbidities, and stages of heart failure. 2. Regulatory approvals. Assuming continued positive results, engineered muscle patches could receive regulatory approval from health authorities, such as the FDA and EMA, within the next 5 to 10 years. This would pave the way for broader clinical use, making the patches a viable alternative or adjunct to traditional heart failure therapies and transplants. 3. Integration with other therapies. Engineered muscle patches may not work in isolation. Future advancements could see these patches used in combination with other treatments such as gene therapy, cardiac devices, or pharmacological interventions to enhance overall patient outcomes. This integrative approach could lead to a more holistic management of heart failure. For a personalized medicine, advances in stem cell technology may enable the development of personalized muscle patches derived from a patient's own cells, reducing the risk of immune rejection. This could further enhance the safety profile of the treatment while promoting more effective healing and integration with the host tissue. 5. Technological innovations. As regenerative medicine continues to evolve, innovations such as 3D bioprinting and improved biomaterials could enhance the design and functionality of heart patches. These technologies could lead to patches that better mimic natural heart muscle, allowing for improved integration and performance. 6. Broader applications. While the current focus is on heart failure, the technology behind engineered muscle patches may find applications in treating other forms of cardiac damage, such as that resulting from congenital heart defects or ischemic heart disease. This could expand the market and impact of muscle patch technology beyond heart failure alone. 7. Cost-effectiveness and accessibility. As the technology matures and production processes become more streamlined, the cost of engineered muscle patches may decrease, improving accessibility for patients. This could be particularly transformative in regions with limited healthcare resources, where heart failure is a significant public health issue. 8. Patient outcomes and quality of life. Ultimately, successful implementation of engineered muscle patches could lead to improved survival rates, reduced hospitalizations, and enhanced quality of life for millions suffering from heart failure. This would not only alleviate the burden on healthcare systems but also improve the overall well-being of affected individuals. 9. Long-term follow-up studies. As the patches are used more widely, long-term follow-up studies will be essential to assess their durability, potential complications, and long-term impacts on heart function. This data will be crucial in building a robust understanding of the benefits and limitations of this treatment approach. 10. Ethical and social considerations. As with any emerging medical technology, ethical considerations surrounding the use of stem cells and genetic engineering will be prominent. Ongoing dialogue among scientists, ethicists, and the public will be necessary to navigate these issues responsibly. In conclusion, engineered muscle patches represent a significant advancement in the treatment of heart failure with the potential to provide hope for millions waiting for transplants. The next decade will be critical in determining the full scope of this technology's impact on cardiac care, patient outcomes, and healthcare systems worldwide. As research progresses, the integration of these patches into clinical practice could herald a new era in the management of heart failure and other cardiac conditions.